People are living longer with heart disease.
Good news from Dr. Sarah Levin, cardiologist with HealthQuest's The Heart Center. She says treatments for heart disease have come a long way. If you have a heart attack, you have a much greater likelihood of living a long life. But prevention is an area where we're not quite as far ahead.
I think that's something we need to continue working on, particularly with our youth, because we're seeing a lot of young people who are becoming diabetic, they're obese, they have hypertension, they have diseases of old age when they're young. And that is going to destine these kids to develop cardiovascular disease at a younger age going forward if we don't really get on top of it. As they get older and they're adults, they have hospitalizations, they have decreased productivity, they have decreased lifespans. I mean, it's a huge impact. So focusing on risk factor modification in kids as well as young adults, young women, young men, before they really think they have to worry about it, will hopefully translate into prevention down the road.
Prevention and treatment of heart disease is not a one-size-fits-all process. Dr. Levin stresses it's important to have a relationship with your physician.
And talk to their physician. What is the family history? What are their risk factors? Not everybody needs an aspirin. As you've been seeing on the news, there's a lot of questions about should everybody be on an aspirin? Should everybody be on a statin? And there's no one-size-fits-all approach.
Dr. Levin says it's also important to continue the conversation with your doctor and follow up on a regular basis.
And sometimes people will come back a few years later and they won't have seen us. And much of the time they're doing fine. They have a primary care provider who's doing an outstanding job following them and is helping them with modifying their risk factors. But sometimes they just kind of feel fine and don't go see anybody. So we try to keep people seeing us at least once to twice a year if they do have significant heart disease, just to make sure that we're all on the same page. Things change. Recommendations change. Medical therapies change. What was the right therapy for you 5 years ago may have changed and may not be the right therapy. So for all those reasons, it's and also we can check in on lifestyle and see how much somebody's exercising, talk about diet, do all of those things. It doesn't just stop with take these medicines and be done, because it's a two-pronged approach, the lifestyle and the medical.